Hi, my name's Ashley Wombles, and I'm doing Estem for my case. And my patient came in complaining of back pain and saying that they had muscle spasms and her range of motion was decreased, and she just had pain in her lower back. So today we're going to do Estem on her, and we're going to do the bipolar pad placement, and that means it's only going to be 2 pads. We're going to do 2 on this side, and then we'll do it for about 5 to 10 minutes, and then we're going to do it on the other side for 5 to 10 minutes. I would say we'll do it for about 5 minutes on each side. We don't want to put 4 of them on there at a time because we don't want the current to go across the spine, because that's very dangerous. We do that. What Estem does is helps with decreasing muscle spasms, helping your range of motion. It's more of like a muscle re-education, so we're helping strengthen your muscles again in the back, and it will help with your pain. You don't have any like skin lesions or any like torn tissues or anything, right? Okay, so if you had that, then we wouldn't want to do it. You don't want to stick Estem on the brain, obviously, because that's dangerous. You don't want to stick it over any like pacemakers or anything, because that can cause more problems for you, and it's really dangerous actually. Then what it's going to feel like is it's going to feel like pins and needles, but it's not going to be hurting. It's going to be more of like a moderate thing. You will have like you'll feel like a muscle contraction, but you're not actively doing it, you're passively doing it. So we're going to stick each one of these on the top, and then one on the bottom, and then you stick it on 15 pp's, and it's more of like a moderate type for Estem. But yeah, we'll stick 2 of them on here. For the pads, we only have like the little ones. You technically want to use the big ones so to cover more of the muscle, but all I have right now is the little ones, so we'll just use the little ones for now. And then once our time limit is up, then you got to make sure that the Estem is completely off before you take them off the patient, because that can hurt them too. So after it's done, then we'll take them off after time limit, and then we'll just place them on the other side, and then we'll leave it on for about 5 minutes. Why I chose Estem is because it actually helps the patient with their pain, and it's more like when you do Estem, it's like a muscle contraction, so you're trying to help the muscle like re-educate itself. You're trying to help it strengthen. It'll help your range of motion. It'll help if you have muscle spasms in your lower back. It'll decrease them. It'll help with your blood flow to your muscles to have like a muscle strengthening contractions and stuff. And that's pretty much it.